Hello, people. I'm Dr. Mia from grandmamedicine.net. With all that videos, I forgot to explain to you what I do. I'm a health consultant. A health consultant is what? People know financial consultant, but they don't know what health consultant is. I went to medical school, chiropractic school. I worked in the pharmacy for many years. All that educations and experience treating patients for many years with traditional practice. It's called practice. I don't like that term. Health consultant is, financial consultant is you have 100,000, you want to bring it to people that you say, hey, make this into $1 million in 10 years. Health consultant is you bring your body to me and you say, make this body, when I'm 80, I don't pee in my diaper. To keep my body healthy naturally, and that's what I do. Anything from head to toes, from headache to vision problem, to smell, to allergy, to taste, to hearing problem, to swallow, breathing, heart, diabetes, hypertension, high cholesterol, digestion problem, numbness, muscle cramp, autoimmune disease, anxiety, depression, anything to big toes, gout, I would treat you naturally. Problem with erectile dysfunction too. I would teach you a natural way to take care of your body. From my diverse background, because of culture diverse, I speak Vietnamese, Chinese. I can argue in Vietnamese and Chinese and English. That is when I say you speak the language. So I'm a health consultant. Health consultant, people always pay attention to money, but I read a lot of famous people. Aristotle, Onassis, when he was dying, he wished to have a good health, pay attention to his health. With all this money, you don't have health. Howard Hughes, the one that was responsible for Las Vegas to build, also wished that he had help, but the people that help him get addicted to drugs so they can control his company. So I like to read a lot, especially biography, famous people, wealthy people, smart people, to see what they think about health. You know, what is more important thing? What make them tick? At the end, everybody talk about health, but nobody take care of it when you have it. Only when they see their coffin in the shadow, they say, oh, I need to bring my money to exchange for health. Don't wait too long. Your body begin to break down after you complete build up. Most of us reach our maturity 18, 21, but small percentage reach the body maturity at 25. Could be 26, 27, small percentage vary. From there on, your cellular level begin to break down. So when the cellular level begin to break down, you don't notice, because 10%, I give you example on kidney dialysis. When all your cellular level in your kidney is not able to filter for you anymore, at 20%, you need artificial machine to help you filter, and that's called dialysis. So I use that example that your body begin to break down, you begin to have indigestion, unable to sleep, but that not until you lose 20, 30%, like in your 30, late 30, in your 40, your 50. So people don't think about health until they're 50, 60. And if you take care of your health early, so all your cellular level break down slower, then by the time you're 80, that's estimate life expectancy. You want to die peaceful, die fresh. You don't want to rely on anyone to feed you, to bathe you, or to walk you. or remind you to eat, remind you go pee because you maybe saw in your diaper and don't know. That when I was in medical school, I have to do internship in a poor area because medical student, they don't allow you to go to a wealthy area to check on patients. So you go to nursing home, hospital, and you see people that the reason the medical system is you want to see if it's good, you measure the outcome. And the outcome of our medical system is not good. Our elderly are dying pitifully in a nursing home. No one take care, being abused, smell. And then I have a chance to go visit my neighbor that she moved to assisted living, but she's very wealthy. So she being taken care of very well. I think she had to have $250,000 in the bank, and she had to pay $10,000 a month. She can order food from the button, push the button from the menu. Eat anything she wants. She put the button, people come and walk her. Her room smell good. Her towels, her bed sheet change every day, but not regular nursing home. Regular nursing home is the one that you Medicare, the elderly don't take care of their body and don't have the finance to live like Mark, my neighbor. So actually health is very simple, it's very cheap. Supplements, it's only a few dollars a day. Exercise, just move around. And it's very simple to take care of natural health. But people don't see it that way. Every time they have a symptom, they go to doctor give a pill to numb it. And that accelerates your cellular breakdown. When you block something in your system, in medical school, they taught a pathway of cholesterol pathway, opioid pathway, how protein metabolize in your system, how carbohydrate metabolize in your system into sugar. But they never taught us THC pathway. THC is marijuana, active ingredient for marijuana. Marijuana helps with many conditions, but because drug companies are very powerful, so they don't want it to legalize, and they have a lot of influence on medical curriculum, what we learn in medical school. So if you want to be healthy naturally, you look for someone like me or philosophy like me in your town. If you don't, I can refer you to someone in your town that help you. And that's the best way. You respect your body, and your body will work for you. So health consultant, that's what I do. I'm lucky that we have business, my husband owns business. Otherwise, I'll be homeless doctors. I realized that many years in California, when I practice, I take insurance, Medicare, I have a lot of patients. But when I being audited, because I lie about the diagnosis more, so I can treat patient naturally. And the insurance company told me you cannot do that. That is for wealthy people to be treated like that. These people are poor, you don't treat like that. So I thought, hey, my patient know that I can get them walk again from wheelchair, healthier, naturally. Maybe I switch to cash practice, and I find that my patient disappear. Nobody want to pay for health. They pay for everything. People will pay for fake boobs, fake eyelashes, nice handbags, fashionable shoes, but they will not pay for good health. Unfortunately, that death knock you at the door, then you pay attention. Don't wait too long. Take good care of your body, because nobody can take care of you when you get sick. They might be temporary, even spouse. Do you want to die with dignity? In my book, I say to good death and die with dignity. And there's a hospital here locally, took my name. But of course, I'm a peanut, so I don't sue them or any compensation. Just like this video, I'm helping you to understand your body, how your body works. And you look for someone that you trust. And you learn everything from them about health, how to take care. And you don't get everything from that person, you go to the next master to answer the question that you look for. Be active in your health. Don't be zombie. Other people don't take care of your health as good as you, especially internists or family doctors. They don't know anything about health. So health consultant, that's what I do. Okay? You need any help? Contact me or Elle. As long as you, people said that how come you don't talk about smoking, over drinking, overeating, abuse, illegal drugs. All that you know, you kill yourself. All the abuse that you know that you damage your body, I'm okay with that. The only thing you don't know is actually damage your body is doctor will actually damage your body too, and you pay them to do it. But at least when you damage your body, you pay yourself and you have some pleasure out of it. My mother smoked for many years, and so I gave her a lot of supplements. And I explained to her that smoking will not healthy for your blood vessel and your circulation, because the exchange of oxygen to your system should be pure oxygen, not smoking. So every exchange you lack of oxygen, so your cells will have no oxygen to live on, and that's how the damage begins. But mom said, hey, that's the only pleasure I have, only vibes. So I might well die instead of give up. So I understand where she come from. She had a hard life, and she finally get to enjoy it. Then she just continued to smoke until a few months before she died. But she died fresh, and died look very well nourished, and that's what you want. You don't want to be mutilated and treated by medical doctor, and when you die, no one recognize you. And that's not scare tactic either, okay? Just sincere and honest. Until next time, I'm Dr. Mia from GrandmaMedicine.net. Take good care of your body because no one cares about you except you.